Hello, fish keeper, dear aquarist or fish health manager. Today I'm presenting you another video on a fish case, fish disease case. I have my winter outfit here. I'm not in the cold, I'm in my office recording a PowerPoint presentation. But as you see, this is the winter time where we also encounter problems with the fish. So let's be optimistic about the climate and enjoy the beautiful northern light. And let's enjoy my presentation, number 48, case on fish diseases about lohachata botia, which had a bacterial and a parasitic Sporozoa infection. They are from the wild, so you can then find some wild disease problems which are not usual. And here I show you on the video that some of the loaches or the botias are becoming skinny. They're not actively moving. You see one here up front. They're losing their color. They're getting skinnier. They're wasting away. Abnormal behavior, and they die. And that's why an examination had to be done. And we first started with taking a skin scraping here at 300 magnification. You see here the mucus from the scales, and you see here the many tiny black dots. Those are all bacteria. Here at 400 magnification, you see the millions are small black dots, which are motile bacteria, which are in this quantity too many. And you see some of the colonies on the side here at the mucus or here. And that is something which is typical when we observe bacterial infections in fish. We also found the gills that they were badly damaged due to a bacterial infection. And that means the fish will suffer and die from suffocation, because the gills is like pneumonia for human. This is something that eventually kills the fish because it's in a very bad shape, that respiratory organ. We took the organs and we squeezed them between two glass plates, and you could see the organs were very pale. The liver, we see here the gall blatter, here is the spleen, here is the intestine. So we examined the organs and we found that the liver was very fatty, pale color, not normal. The spleen had a lot of bleeding marks or melanomacrophage centers. That's not a healthy spleen, and it's most likely due to bacteria, which are inside the fish, outside the fish. We also find a lot of Sporozoa here in the gallbladder. All those little particles, those are groups of Sporozoa. I don't know which one it is, but it's very bad for the fish to have this in the body. Here you see them at the 300 magnification, and here at the 400, they're all Sporozoa here encapsulated in this spore. So this is on a wild fish, an unusual case. What is not unusual is the bacterial infection, and you can see it on the gills. So the fish become weak, and the worst infected fish, you better put to sleep in a gentle way. You euthanize them. Try to use an antibacterial treatment that you can obtain from your vet, like an antibiotic, or from your shop. They sometimes have also good antibacterial products. Unfortunately, there is no medication to control the parasitic Sporozoa infection. That's why you have to euthanize the weaker fish. And with your help of good medication against the bacteria, you can help the fish to overcome the bacterial infection. And you can help with a fish food to strengthen the fish, like with our Dr. Bassleer, Bichet food, grapefruit seed extract and moringa, or the fuco, or our professional treat, to feed them during 20 days, and you will do not give any other food. And that might strengthen the fish to become much stronger, and maybe they'll live with the Sporozoa infection for some time or forever. You don't know. That is something we cannot see unless we open the fish and see what's going on. But the antibacterial treatment and the feeding with our specific food might help your fish to survive much longer. So I thank you for your time to become a better aquarist and to learn about fish diseases. Stay tuned for my next cases, because more to come in the coming weeks. Thank you.